Welcome to Neural Newscast. I am Daniel Brooks. It is a significant week for organizational changes, ranging from the structured world of professional sports to the, essential infrastructure of our healthcare systems. We begin today in Atlanta, where the Falcons are moving rapidly to fill the vacancy at the top of their coaching staff.
And I'm Evelyn Hartwell. You know, Daniel, the Falcons' search for their 20th head coach is already drawing some of the biggest names in football. Following the departure of Raheem Morris, the team has been interviewing candidates like Mike McDaniel, who led the Dolphins to consecutive playoff appearances, and John Harbaugh, a Super Bowl winner with nearly 2 decades of experience in Baltimore. It is a high-stakes moment for a team looking to rebuild its competitive edge. I mean, truly.
What strikes me about this search, Evelyn, is how the Falcons are using this moment to reshape their entire corporate and football hierarchy. Beyond the coaching candidates like Kevin Stefanski or Seattle's defensive coordinator Aden Durde, the team has just appointed former quarterback Matt Ryan as the president of football. This is a clear attempt to bring institutional knowledge back to the front office alongside Greg Beadles, who has been named the new CEO.
Right. It is a strategy that prioritizes stability while simultaneously reaching for fresh tactical minds. I mean, we are also seeing a heavy interest in the Seattle Seahawks staff, with interviews for both Aden Durde and offensive coordinator Clint Kubiak. These are individuals coming off a record-setting 14-win season. It shows a desire for a culture of resilience and winning, which is a fitting transition to our next story, though the circumstances in New York are much more dire.
Yeah, while the Falcons are focused on internal growth, New York City is dealing with an external crisis in its labor force. Thousands of nurses have officially begun, it is the largest strike in the city's history. Nearly 15,000 healthcare professionals from 5 major privately run hospitals, including Mount Sinai and Montefiore, walked off the job early Monday morning. This is not just a localized dispute. It is a massive urban challenge affecting the city's ability to provide basic care.
The scale is truly unprecedented. Negotiators failed to reach an agreement before the deadline, leading Governor Kathy Hochul to, declare a state of emergency. The sticking points are significant, Daniel. The New York State Nurses Association is pushing for approximately 40% wage increases and stricter staffing mandates. The hospitals are calling these demands reckless, and Montefiore has already warned that they are preparing for a strike that could last for weeks.
From a policy perspective, the state of emergency is a necessary but, temporary fix. It allows the city to move resources around, but it does not address the underlying exhaustion and financial pressure these nurses are describing. When you have 15,000 people walking away from critical care beds at Mount Sinai West and Manhattan, the infrastructure of the entire city's health network begins to strain under the weight.
Exactly. We are seeing a clash between the financial sustainability of these hospital systems and the urgent needs of the people who staff them. It is a reminder of how fragile our essential services can be when labor relations break down completely. We will be monitoring the impact on patient care closely as this week progresses.
Whether it is a football franchise or a major metropolitan hospital system, leadership and labor are clearly at a crossroads this month. Thank you for joining us today. I am Daniel Brooks.
And I'm Evelyn Hartwell. We will continue to track these developments and more. Neural Newscast is AI-assisted, human-reviewed. View our AI transparency policy at neuralnewscast.com.